I'm Ann Kalis, and I'm the CEO at Starfish. I've been very privileged to serve in this role for the last 10 years. And we really appreciate your getting out of the house early this morning and joining us for a conversation that we hope you learn from and that you are inspired by. Because this breakfast is in part kicking off a several-month celebration of the Beaumont health system, leading up to an award that Starfish is going to bestow on Beaumont in May, I thought I would also just introduce myself in the context that I was very proud to serve on the Oakwood healthcare system for a few years before the merger, and that I currently work with Eric Widner at the Beaumont Wayne Hospital to serve on the Community Advisory Board. And I also just like to say a personal connection between myself and Beaumont is that 21 years ago next week, I delivered my oldest daughter at Beaumont Royal Oak. So I feel both professionally and personally connected to many of you in the room that are also connected to the Beaumont system. We at Starfish have been really honored to have a strategic connection to Beaumont, largely through the old Oakwood legacy system, for a couple of decades, and that's looked like Starfish leadership serving on the Oakwood board and Beaumont leaders now serving Eric Widner, for example, on the Starfish board, and really just working together, recognizing that so many of the families that we serve in the healthcare system and at Starfish are the same families, so it only makes sense for us to work together. On May 18th of next year, Starfish will award our 2018 Great Hearts Award to Beaumont Health at Ford Field on a Friday night, and it's always just a very celebratory and engaging evening, and we hope that many of you will consider participating in that event honoring Beaumont in the spring. So the idea behind this morning's breakfast, and we held breakfasts last week in Grosse Pointe and then the week before in Birmingham, is really just to have a smaller gathering where we have a little bit more time and space to meet each other and also to showcase both the work of Starfish and the work that we're doing together with Beaumont. So before I just give you a quick overview of Starfish and introduce a panel that will be way more interesting than I am, I'd like to just acknowledge some key people who are in the room, and starting off with Doctors Don and Cheryl Kahn at the front table here, who are co-hosting the breakfast this morning and involved in helping us ensure that the gala is a great success next year, and we appreciate their support and leadership. I'd also like to recognize Karen Smithbauer, and I didn't see where Karen sat down. Oh, hi, Karen, who, along with her husband, have agreed to serve as honorary co-chairs for the gala coming into next spring, and we have had wonderful support from Karen's foundation, and of course we know that she is a huge champion and supporter of the work of Beaumont as well. And I would just ask for a quick show of hands of Starfish board members, past and present, who have joined us this morning. We have an amazing board that is so aligned in moving our work forward. So just very quickly, to give you an overview of Starfish, for more than 50 years, Starfish has been in our community helping children who face barriers realize their full potential in life. And that could be poverty, family dysfunction, it could be living in neighborhoods that are unstable, where there's violence. We are wrapping everything we've got around those kids to ensure their success. It's really been over the last 20 years that Starfish we reinvented ourselves to see this connection that kids live in families and that we have to work with both children by providing them with quality programs, but helping their parents thrive and to keep families together. So we've really been thinking about how do we invest in families And our founder, who I had the privilege to replace about 10 years ago, had a great saying, which was she wanted to teach families how to swim rather than pull their bodies out of fast-moving rivers. So we're always looking at how do we move upstream. So as I said, today our programs really recognize and respect that kids live in the context of families, and we have to work at both of those levels, and more we have to look at the community level as well. So what that looks like today is that every day Starfish is responsible for about 1,800 low-income children, 0 to 5, in quality early childhood centers from Detroit out to the western suburbs of Wayne County. We have preschool classrooms, infant toddler classrooms, publicly funded largely, and it's all about a quality classroom with supported teachers helping children develop both physically, social, emotionally, cognitively, that they're curious, that they have initiative. So you can see the scale of our work. We also have a full range of children's and family mental health and counseling programs, and we're going to talk more about that in just a few minutes. And lastly, we have a continuum of parent programs that help the caregivers of those children, and it could be financial literacy, parent education, life skills training, again, working at multiple levels. So in a minute or two, I'm going to introduce some of my colleagues who are going to go a little bit deeper into our clinical work at Starfish and talk about some of the integration that we're doing with Beaumont practices and Beaumont hospitals. The integrated healthcare work that you're going to hear about really comes from a couple pieces of knowledge. One is that we need to connect more children and families to mental health programming. And like so many of you in the room that are in the healthcare system, we know that the brain and the body are intertwined, and we need to work with families with that recognition. We also know that in order to connect more kids to the mental health system, that we have to overcome some barriers like stigma and access. So to break down those barriers, what Starfish is doing is we're putting our mental health services where we know kids and families show up. So that's in our early childhood classrooms, in schools, in primary care practices, in labor and delivery, and again, in this idea of moving upstream into OBGYN practices, and you'll hear a lot about that. So that's why our partnership with Beaumont is so important, to bring our services to where kids and families are. I would like to introduce, I'm going to introduce all three panelists, and then we're going to hear from each of them, and we'll have time if you have questions or follow-up for the panel. So first, I would like to introduce Dr. Maria Music, and Dr. Music is a longtime partner of ours at Starfish. She is an assistant professor in the psychiatric department at the University of Michigan, and she is co-director of the Women and Infants Mental Health Program at the University of Michigan. And really, she has been just such a key champion and just friend to Starfish in both innovating with our programming and, equally as importantly, researching our work so that they're sustainable, because we're proving the impact. So we're really happy. I know you're going to enjoy hearing from Dr. Music. Next, I'm going to introduce two of my Starfish colleagues, and the first is Shai Johnson, who's sitting here. Shai has great master's degrees for the work that we do in both early childhood education and in counseling, and she's been working in this field for 20 years, and she supervises our integrated infant mental health program at Starfish. So she leads a team of innovative clinicians, and you're going to hear more about what that looks like in a minute. And she, I think, was our first infant mental health therapist that worked with Marcia and Eric and the whole Beaumont Wayne team in the labor and delivery ward at Wayne, starting several years ago. And then also my colleague, Christina Figueroa, who's been MSW for about 17 years, and she's been an infant mental health specialist for 9 years, the last 3 at Starfish, and she'll tell you how she became an infant mental health therapist, and she now supports Beaumont's labor and delivery wards both in Dearborn and Wayne, and OBGYN practices. So I would like to welcome all 3 of them, and I know you'll be interested to hear from them.
So it's a great pleasure to be here today and to tell you a little bit about this amazing project, Integrated Infant Mental Health. What is it? We will lay the ground to tell you about this. I would like to start a little bit with a historic perspective, and I will tell you the story from both aspects, from the mother's side and from the child's side. Why I believe, as a psychiatrist and psychotherapist, that this is tremendous important to invest in programs like this. Let's start with the mother's side. I'm from Austria. I have to tell you a little story. 200 years ago, around 1850, there was a OB, Ignaz Semmelweis, who discovered that women are dying in childbed fever, because infections, at that time they didn't know it's infections, but he recognized that something is happening, that women are dying. 20 to 40% of all women did not make it through childbirth. And he was the first to recognize that there is something going on that might be transmitted. Years later, bacteria and infections were discovered, and then almost 100 years later, by chance, in 1929, a Scottish biologist who was studying bacteria growth in petri dishes and went on a vacation and came back and then saw that in one of his dishes, the bacteria is not growing because there was some mold juice, discovered by chance penicillin. And that was revolutionizing medicine. And within 10 years, penicillin was commercially produced and actually changed history, changed medicine. And I think we have infections down. We can now treat infections very well, and women are not dying. Mothers are not suffering from infections. We still have infections, mostly viral now, but there are other conditions that are impacting women's lives today in pregnancy and postpartum. Many of you are working with women, so you know what the factors are that increasing maternal mortality. We know it. In the Western industrialized world, we have in the US currently 20 women, 20 deaths per 100,000 live births. So maternal mortality is high, but what is it? It is things like preeclampsia, it's issues like high blood pressure, highly related to depression. Depression in pregnancy and postpartum is increasing the odds for poor outcomes for women to come to antenatal care or to follow through with postpartum care or to engage in risk behaviors during pregnancy that increase poor outcomes. So addressing depression in pregnancy and postpartum would be one of the major factors to improve health on the maternal side. 1 in 7 women suffer depression. Only less than 10% actually make it to treatment and get detected. So if we want to make a difference, addressing mental health, that is the breathing ground that for other physical conditions, poor conditions, is a major task. That's the story from the mom's side. Let's talk about children. In the 1980s, there was a big study that also changed how we think about early child development and the impact of the first 1,000 days on later life. It's the Adverse Childhood Experience Study. conducted in California at Kaiser Permanente. Vince Felitti and Bob Under did a study to understand why their adult patients, why are they not doing well? Why are they not following through with recommendations? And so they assessed a lot of factors. They tried to really understand who are our adult patients who are not doing well despite all this great care they're getting. And what they found is that it goes way, way back. That what happened to these adults when they were children in the first years, that had a major impact on their biology and psychology across the lifetime and increased their risk for bad outcomes and illness. So early childhood, the first 1,000 days, pregnancy, fetal development, as well as these first years, the first year of life, are fundamentally important for children. And what is it that they are mostly proximally exposed to? It's the parental wellness. We can buffer what we now call toxic stress in children's lives, in early life. We can buffer it. What is the buffer? Healthy, safe relationships with their caregivers. And that's where these two stories for children and for the parents, the moms, are linked. If we have depressed mothers that we don't recognize and treat, if they are anxious, if they engage in poor coping with maybe substance use or poor antenatal care, we do not buffer these children already in pregnancy or early postpartum. This is where it comes together. We need to support parents, the moms, early. We need to reach them early. So I said only 10% of those who are affected get detected. That's why we need to be there. We need to access. We need to find the women where they are. And OB care is the best place to get started, carry moms and families through the pregnancy to health and well-being, and then continue postpartum. And that is the power of what we call infant mental health. It's the health for the infant as given and nurtured by the parent. So it should be called parent-infant mental health, because it's really, the infant is carried and held in the arms of the parents to well-being. And so this is an intervention that is powerful. We have wonderful results from this intervention, that it's really buffering toxic stress. We just have to bring it to those who need it early. And therefore, I really believe in this project that spearheading Starfish, Beaumont, and the University of Michigan, trying to understand what is the benefit. Can we track it? Can we evaluate it? And really get it on paper. What is the value of this early intervention, already starting in prenatal care with behavioral health consultant who is also an infant mental health therapist, who then can also continue to follow these families in the home and postpartum. That's the beauty of this project. It's highly innovative, and we think, we already know it clinically, but now we want to prove it also, that this is going to be impactful and save lives. It's the same revolution in medical and mental health care as penicillin was in the 1929. I think that now we know how to prevent toxic stress and sequelae by early intervention. We just have to invest in it. So thank you.
Well, good morning, everyone. I'm Shai Johnson, and as Ann said, I've had 20 years experience working with children and families, and I began my career in education, and I was a preschool teacher, and then I moved up into becoming an education administrator. And in my role, the reason that I worked hard and wanted to be in education is because I wanted to help children and families. And what I noticed was the need in providing care for both the parent and child, even in the education arena. And as I looked around and I said, there's got to be something that can make a difference quicker or earlier in the child's life. And then I heard about infant mental health. As she stated, it's an early intervention. And I decided to change my whole career. And I went to school to become a counselor. And with that in mind, with the thought in mind that I wanted to have an opportunity to impact the lives of children and families. And long story short, I became an infant mental health therapist. And just to break that down a little bit, that was the space where I was able to go into the homes and meet the families where they lived on their own terms and see them as they saw themselves in that arena. And it's not difficult, but difficult to describe sometimes, but it's the need to allow the family to just be, and to be there and be present with them, and to increase their awareness of each other. One of the things that we say in infant mental health, we want to help the mother see the baby, even in the situations where there may be toxic stress and trauma and things of that nature. And as I began to work this out, I said, wow, this is amazing. And I started realizing that I was bringing my clients, I worked at another agency, to Starfish. And I said, what is going on here? I said, if I'm bringing my clients to Starfish to receive services at Starfish, then maybe I need to be at Starfish. So I made a shift. And I came over to Starfish, and it was at just the right time, the most opportune time, because there was this innovative program starting where you have an infant mental health therapist go onto the hospital labor and delivery floor, as well as go into clinics, and which at the time I was like, I never heard of this. But what this was all about was reaching the mothers, or what we call preconception, reaching women ages 15 to 44 before they even get pregnant, helping them with those things such as toxic stress and trauma before they become pregnant. And I was like, that's amazing. And that's what we're able to do inside of the clinics. When we're there, we're assessing for those stressors and those things that keep women from having a healthy life as a whole. And we're also there assessing even the moms, amen. Sorry, I did it again. We're assessing the moms, and we're assessing the baby's relationship if we have the opportunity once she becomes pregnant. And from there, what we are able to do is to make sure that there is a lifeline to an infant mental health program. And the one thing I really appreciate about Starfish is we're not there just taking clients and just in that nature. We're sharing clients. We want to provide the client with the most quality care. We're there to protect and preserve the relationship of the moms and babies. And that fueled my passion, because I could understand the barriers that could stop moms from receiving services. So sometimes when we send parents out for referrals and we send them to a therapist or we send them to a resource, they don't always go. But having us there inside of the clinic, we are the resource. We are the connection. We are the ones that are there to give them the soft handoff. And we're there also to be the one to say, you can do it. And you are strong enough to parent and do what you need to do as a mom and a baby. And we don't just focus on moms and babies. We also include the dads in these services. When we do assessments, we're thinking about the whole family. We're not just thinking about just this baby, just this mom, but the whole family. And we're thinking about the needs that concern the whole family.
Good morning. My name is Christina, and she did a great job. My name is Christina, and so I'm an infant mental health therapist and also a behavioral health consultant. And so I've been in this role for the last 3 years. And like Shai, I enjoy working with children and families. And I just was thinking about this as she was talking. I started off to be a teacher. And I realized that wasn't my place to be a teacher. And so I started my journey into social work. And I share my story about how I became an infant mental health therapist because I always say infant mental health chose me. I was in my last year of graduate school and I was very pregnant, and I had somewhat of a difficult pregnancy. I was on bed rest, but I begged my doctors to let me go back to school and finish out the last part of my semester. And so I graduated with a brand new baby, and that was exciting. And as I was graduating, I was hearing about infant mental health, and I said, well, this is interesting, but I'm too far into my program right now, so I'll look at this a little bit later. And when I went for my first interview after getting my master's degree, the position that I interviewed for was a very different position than what I got hired for. And I got hired for as an infant mental health therapist, and that really started my journey. And so starting the journey of infant mental health therapist and being a new mother was really life-changing for me because it opened me up to understanding different aspects of parenting. I always thought that I'd be a good, nurturing, kind mother, but infant mental health really taught me how to really see my baby and understand my baby and respond to him in a way that was more than just being, what we think mothers do, but in a much deeper way. And so when I had my first son, we were excited. I had this amazing experience, and I was in love with him and just was excited about being a mom. And my husband and I decided to grow our family a few years later. And I had another little boy, and I was so excited about having another baby and another little boy. And when I delivered my son, I had a very different experience with him. I had a very difficult labor and delivery. And when I had my baby, I quickly knew something was different this time around, and I didn't quite understand what was so different. With my first son, I had this euphoric feeling. I was all in. And with the second baby, I looked at my baby and I said, I love you, but this is different. What's going on? And so I ended up having some medical issues that really kind of took precedent. And so my husband had to go home and stay with our 5-year-old, and the nurses had to take my baby and keep him away from me, not in a bad way, but because I wasn't able to care for him. And it started a separation from us immediately. And I didn't understand what was happening. And I just kept saying, where's that euphoric feeling? Where is that feeling of being in love and just knowing that this is perfect? I want that. Where is it? And I quickly realized that I maybe was having some issues with postpartum depression, and because of the trainings that we get from Maria and just being in this field and understanding, I was kind of quickly able to put some pieces together and recognize that this was a different experience. And so Shai and I met through trainings, and I heard about Starfish having this position where a therapist can come into the room and speak with a family and talk about services. And I was quickly intrigued because what I needed when I had my baby was someone to knock on my door and say, are you okay? How are you feeling? This must be hard. This is different from your last time. I have that opportunity to go into a room and knock on the door and say, are you okay? How are you feeling? And to talk to women about what may feel like rainbows and sunshine or dark and cloudy days. And that's an opportunity that we don't get. And I'm so grateful to have that opportunity. I want to share a story about a young lady that I recently interacted with. And she, for me, is what integrated health is really about. This young lady, I believe she's about 20 years old, and she's the mother of 2. And so she was in the clinic for her prenatal visit, and the medical assistant came to me and said, Christina, we have a young lady we need you to see. She's presenting as depressed, and she's crying, and she's talking about adoption, so can you go and see her? The doctor wants you to see her. So I went into the room and I knocked on the door and I said, I'm Christina, I'm a behavioral health consultant. I understand you have some questions about adoption. How can I help you? And so she shared with me that she had a baby that was 10 months old. And this was an unplanned second pregnancy. And she was overwhelmed. And she wanted to give this baby up for adoption because the baby that she had at home had significant medical issues that would be too much for anyone. And she was overwhelmed and she had very little support, and she really wanted to give her baby up for adoption because she felt guilty about having to take away time and attention from her baby that needs her. And her family was not for it. Her family said, no, you can do this, you're gonna do it, and that's the end of it. And so she was quite conflicted about what to do. So we talked for about 20, 30 minutes, and then I said to her, when you come back for your next visit, I'll come and check on you. Can I come and see you? And she said yes. She came back for her next prenatal visit, and I talked to her again about services, and she wasn't ready yet, and that was okay. But she was coming back for prenatal care, and that's what was important at that time. So a few weeks went by, and I received another referral from the social worker in the hospital. And she said, there's a mom who just had a baby. This is her second baby, and she's thinking about adoption. Can you come and see her? So I said, okay. So I walk upstairs, and guess who it was? It was the same young lady. And so I said to her, how are you feeling? What are you thinking about? And she said, well, I'm just gonna take the baby home. I'm gonna parent her. It'll be okay. Very indifferent about this. And that was worrisome for me. And I asked her again, can I offer you some additional support? Are you thinking about therapy at this point? And so she reluctantly said yes, but I knew that really she wasn't quite ready. So as I was explaining to her what it would look like, she said, okay, I can't, I'm not ready, I'm overwhelmed, it's too much, I need some more time. And I said, okay. And I worried about her because my thoughts were, who's going to support her? She's not ready and she's not able right now. Who's going to support her through this? So about 2.5 months go by, and last Friday, I was at the hospital, and I was leaving from the labor and delivery floor, and on my way out the door, our medical assistant, she and I met outside, and this was definitely by chance, and she said, Christina, I just got a phone call. There's a mother who had a baby a couple of months ago. She wants to give her baby up for adoption. She's really overwhelmed. I scheduled her to come on Friday for an appointment, and she wants you to call her. Can you come and call her? I said, let's go. So we go back upstairs, and I get the referral, and guess who it is? It's the same mother. So I called her, and I said, hey, this is Christina. She said, are you the therapist from the hospital, from the doctor's office? And I said, yes, it's me. And she said, oh my God, I need to see you. I'm coming on Friday. Please, can we meet? And I said, absolutely. She's coming back. And she's saying yes to services. And I said, are you sure you're ready this time? She said, I need it. I know I need it now. I'm ready. And I said, okay. The reason why she's such a testimony to integrated health is that this is a young lady that could have been overlooked by so many people. And the fact that so many people laid eyes on her and all recognized that her mental health was just as important as her physical health gave us the opportunity to help this family have a better trajectory than what would have normally happened. The other key piece to this is that typically for young mothers, and specifically African-American women, they do not come back for their 6-week checkup. So the fact that she's addressing her physical health and her mental health, we're doing something right here. And I feel so privileged to be in a place where we're allowed to help moms who have been through the most unimaginable situations, but we're helping them understand that their mental health and their physical health is just as important. And we are here to help service them and provide them with great resources, therapy, mental health, physical health, and really just ensure up that relationship, which allows us to reduce these ACEs scores and have better mental health, better physical health, because now they're aware of it and they feel supported and they're following through. So I just feel so privileged to be a part of an agency and to be a part of Beaumont system and come in and just trust us to help these families and provide them with quality services. So thank you.
We have a few minutes, certainly, to hear or field any questions or comments, thoughts that you have. I just want to say on behalf of Starfish and Dr. Music that doing this work of integrated healthcare takes clinicians, doctors and administrators and hospitals and practices to see the value add in this and to recognize that bringing this perspective around mental health is additive to the medical work that's happening. So we are very grateful for all of the doors that have been open to us and to problem solving, how do we make it work? How do we fund it? All that. We're so grateful for that partnership with across the Beaumont system, the hospitals themselves, individual practices. There are many of those champions in this room, so we're very grateful for that. I can pose a question for sure, but does anybody have a question they'd like to ask our panel?
What's the best way to help providers get involved in the work that you all do? Because you're easily working day to day with the staff that are there, but what's the message to bring it together so that providers are referring or recognizing at the same time?
Well, one of the key things that we like to say when we're partnering, we're partnering. So we like to come to like team meetings. We like to be engaged in even doing lunch and learns and things of that nature so that people can have an understanding of what we do. What happens is that oftentimes we're all working in a silo. Even if we're supposed to be working together. We want to break down those silos. We want to work together as a team, and that's what integration is. And so in reaching the providers, it's necessary for us to be a part of meetings, be a part of the team, be a part of the learning that's happening on a consistent basis. I know like Christina, she is actually at one of the residency clinics. That's a good time when people are residents and they're learning their craft, for her to be engaged with them and learning and understanding the importance of the behavioral health component.
And I would like to put in a plug that, so I'm a clinician by heart, but I'm also an policymaker, evaluator, researcher, and I want to see data. I want to see the things work. Where we invest energy, we need to also make sure that we have the benefits and the impact that we are thinking of, because is it added value? And so that's why we are so grateful, Starfish and University of Michigan, to partner with Beaumont, because we are really now tracking, are we making a difference? If we compare clinics where we have this wonderful program, how are these clinics, the providers' satisfaction, the staff, how are they seeing these programs? How are the patients seeing these programs? How are the outcomes for mom, family, and baby in clinics where we have this program as compared to where we don't have these programs yet? And we are thinking, and we are convinced, that we will demonstrate, as this project unfolds, that we make a difference. And hopefully, long-term, this will become a treatment as usual. This will be standard practice to save lives. As we have penicillin, and nobody argues that anymore, we need to have integrated mental health in primary care, in OB practices, as standard care, because it's going to save lives.
And one of the other things that I would like to add is being in a resident clinic has really been great, because the doctors are, as a part of their training, they're getting that influence of addressing mental health right there as a part of their daily practice. So that's also has been very exciting, because I do have doctors that come to me and aren't really sure and say, well, Christina, what do you think about this? And we're having a dialogue about things, and they're becoming more aware of red flags or risk factors for families, and they are starting to provide more referrals and asking the medical assistants to come and get me, or just to come knock on my door and say, hey, this mom had a high score in the Edinburgh, can you go see her? Which is different than just giving her a piece of paper to fill out and say, okay, thank you. You know, they're aware of what it looks like now, and they have a different mindset of understanding that how important it is to combine the two.
Again, I just want to add, so we started working with the resident clinic, and the residents, the clinicians are interested in saying, we want to be part of the evaluation, we want to be part of the project, we feel that this is impactful. I'm so excited about this, that the new generation of doctors is really kind of saying, you know what, this is important. We want to invest. We are busy. I know they are overworked. Everybody is overworked, but this is important. So you're doing a great job in terms of, engaging and teaching, rubbing shoulder on shoulder and really tackling this together. This is a big issue. If 1 in 7 women have mental health problems, that is increasing the odds for poor outcomes for her and for the baby. And we are treating less than 10% of that, there's a problem. So we need to be better at that.
Not a question, but, just a personal thank you to Starfish because, the services and everything that you are doing are so important. And we recognize that on our unit, and we see and are concerned, for some of the moms, but we are thankful that we have your services because mental health and the behavioral health is, the whole spectrum is so important to the moms and, when they go home with their babies. So I just want to personally thank you and our staff. Thank you.
Well, I thank you because Marcia was my first partner. And she had that vision to be able to know what was needed. And I thank you and giving us that opportunity to share together. And that was one of the things, like Marcia would allow me to be a part of her team and, just kind of be there. And I appreciate that. And that's one of the key things, like being the first person to do this sometimes is difficult, but the passion behind it is it's a driving force. And when you're connected with other people like Beaumont, who's just as passionate, you can get things done. You can make things happen. And that's what's amazing.
How does the world find out about this great thing? What are we doing to tell the story?
That's an excellent question. I think we have to do a better job, is the first honest answer. I think this morning's conversation and the one we had last Thursday and the Thursday before within the Beaumont community, but also among friends of Beaumont and many of you in the room who just care about kids and families. One of the challenges, so I'm going to just tell a quick story, but I know Eric shared with me, Eric Widner from Beaumont Wayne, that based on our breakfast last week in Grosse Pointe, one of the leaders at the Grosse Pointe Hospital actually called Eric because she was dealing with a family last weekend where a baby was born, and the hospital workers, doctors and administrators could see that there were some challenges within the dynamics of this family and that they were short on resources. And she got a hold of Eric and said, how do we get Starfish over here? I saw a family, because she had heard about this last weekend. And so I think it's some of those connections within the clinical and hospital and healthcare leadership system to hear these stories. And one of the challenges that we have, and I'm a former marketer way back in my career, is that it's complicated, and even the terminology of infant mental health. I know that when I joined Starfish 10 years ago, and I'm not a clinician, it's hard to wrap your head around that. And so I think we have to figure out a better way to tell this story, to, the backdrop of Dr. Music's analogy about, we sort of know the penicillin around how we create this buffer and resilience in children. We know how to do it. But it's not a pill. It's more complicated. So we work on that, definitely try to create forums. Dr. Music's been a great partner to be out and about at events like this to talk about it. So we welcome all of your ideas, but I think the testimonials are really important. So just to be respectful, we know that you're all really busy people. We thank you so much for being here. We thank the Cons for hosting us. And for many of you, for your formal and informal leadership and advocacy for what we do. And we hope that you will think about joining us in May for a fun Friday night on the 18th, where Starfish will bestow our annual Great Hearts Award on the Beaumont system, and hopefully also, again, be able to lift up this great work that we're doing together. So we thank you very much. A number of us will be around if you have questions or just want to chat some more, but thank you for joining us.